We continue in the first quadrant. This is the real wire. So this is from collar to the alveolar without a dental rest, has no dental rest. This is placed only in the lower third of the tooth and at the level of the alveolar crest. It's the most elastic of all because the intermediate segment is quite long, V-shaped or S-shaped. The length of the intermediate part is proportionate to the elasticity. The longer it is, the elastic the clasp, the more elastic. So it is recommended on teeth who don't have very strong position in the bone. Their implantation is not very, very strong. So we start with the dental segment, as we said, the one that sits on the tooth. This will have a kind of round, kind of open round arch of a circle. Because it's a molar, it will occupy 2/3 of the labial aspect of the tooth. So when I do that as a technician, I take care not to leave traces on the wire. I don't want to overbend it. I want to make it smooth, as smooth as possible when I bend it. And so this is the active segment, the segment that sits on the tooth, which is the active segment, right? Now I draw a mark there to know where I have to bend it in order to create the intermediate segment, S-shaped in this case. I keep the plan. I lift up the wire and I hold the wire and then keeping the plan. It moved, so I have to start it all over again. I check it again, see, I place it again. Okay, that's the plan. That's the place. Right? And then I bend it. Up, move it again. So the technician kind of guesses now, says, no, I won't do that again. I guess, and okay. So that's how it looks like. Yeah, this technician has a lot of experience, so it's not a problem for him. And you see that now it sits well in place in the two plans, right? It goes exactly out where it should go out, the intermediate part. The intermediate part should not touch the tooth, should not touch the mucosa, should not touch the undercuts of the tooth. It should simply go out. The only thing that presses the tooth is the active segment. And then it has to be away from the mucosa in the end, approximately 1 millimeter away. Right? We don't want we want only the resin to touch the mucosa. And then again, the technician grabs the wire, yeah, and does the second bending. So that's the intermediate segment, right? I have to take into account, although on the model it seems 2D, in reality it's 3D, right? So he has to modify the bending a little bit now. It's not flat. To obtain this, we have to modify a little bit. I rotate a little bit the wire. so as to avoid touching the mucosa, right? So this is a shape that is more 3D, taking into account the shape of the crest, which is a little bit oblique. So in the same way, we have to place the clasp accordingly, the base of the clasp. The retentive part, as you can see, it's placed on the labial side of the denture. It will not create any problem when placing the artificial teeth on the crest. We'll see that when we do it. Now the technician is cutting, shortening the wire, because it was cut to be enough, but now he sees exactly what he doesn't need of it, and the only thing remained is to bend, maybe a little bit shorter. The space there that you noticed, it has to be a space there, so that when the patient chews, the denture goes down, will not touch the mucosa. The clasp should not touch the mucosa. So, the gingiva. Right, so this looks fairly nice now, and he only needs to bend, but keeping the plan of the clasp, you see, because he wants that bending to be in the same plan and positioned downwards, yeah, not upwards, obviously, not towards the teeth, the artificial teeth, but towards the cul-de-sac, the end of the fixed mucosa. So I hold it well in the plier, I rotate the plier, I bend the wire, and that's what I get, the retention that I wanted. So I avoid contact with the model. I can modify a little bit the axis of the bending, and from this point, slowly, a little bit, I just bring it into the perfect position. So it's fairly according to our drawing. If I want, I can use this part of the plier to shorten the clasp, the height of the intermediate zone. So now it's a little bit shorter altogether, right? We extra bended it a little bit. Now in this first quadrant, that could be some idea to place a clasp there that will give us occlusal rest. This is how it looks like. You double the wire, as you see in the image first, and then you bend it as in the image. Yeah, it's a Z-type profile. The preparation for this has to be at maximum 90 degrees, so that the rest that gets into it will not go away from position, be pushed away during mastication. So this is to be placed only on the middle of the crest, obviously, which is under the teeth that we will position there.